talking about the recurrence of these cancerous cells, and you need to go for checkups. Why do you need to go for checkups, and how and why, and what should I do for it not to recur? Perhaps.
Thank you for that question. I think we need to be clear, first of all, any cancer, regardless of its stage, except the terminal one, have a chance of recurrence and has a chance of cure. So after completion of treatment, there's what we call follow-up. You need to be seen for 5 years for you to qualify to be declared cancer-free after completion of your treatment. And the follow-up entails, one, if it was surgery, we do pap smear to check for recurrence, because many times it occurs at the central part of your private part. If it's radiotherapy you are given, you can do annual imaging, that is maybe CT scan or MRI, or some centers we do PET scan, if it's available within your center, for 5 years. So we follow it up. Surgery, we do pap smear annually, that is every year for 5 years. And in between, we can load on the imaging aspect. For the radiotherapy and chemotherapy, we do imaging. You can do annually or biannually, or when there are symptoms that are maybe suspicious of a recurrence, that is maybe bleeding, what we call swelling of the nodes, or there's a discharge or pain, then you are required to do the investigations. One factor that can affect the chance of the disease recurrence. One, the key one is the stage. We say the lower the stage, the lower the chance of recurrence. The higher the stage, the higher the chance of recurrence. Of course, there are other factors, like maybe if you are immunity suppressed, the HIV population. Two, if you are maybe not adhering to the follow-up guidelines or to the doctor's instructions in regards to the annual pap smears for the people who have undergone surgery or the imaging. So those are the issues. In terms of maybe vaccine, there is a little role for giving a vaccine on a patient who has been a cancer survivor for the cervical cancer, because one, the radiotherapy hits and kills the abnormal cells. So whatever is remaining there is not an active, cells are no longer active there. So there's no room for the reinfection of the HPV or on that organ, because basically the tissues are dead, they are fibrotic.
So in short, what you're saying is that for a cervical cancer survivor, HPV vaccine cannot work for them.
It will be of little benefit, of little. If there is, it must be very extremely little.
Okay.
Yeah.
All right, Irene, let us get back to you and your story. Now, talk us through, first of all, have you been declared now cancer-free? And how has that journey been until you were declared? What did you change? What lifestyle did you change for you now to be declared cancer-free?
Well, I'm not sure on my diet. But you see, my doctor told me right from the word go, oh, Irene, this one of yours, you'll get healed. So I registered. My body received. So even when I was getting the chemo was going to my body to heal, not to kubahatisha, because my mind was prepared. That's what doctor is saying. What I can say, I went for 17 chemos weekly, 28 radiations, and 3 brachytherapies. And you see, doctor is saying here, if you get the right medication, you don't get a recurrence, or you rarely get a recurrence. So I can say, I'm here because there is hope. We have doctors who help us, and also God. Yeah. And what I can say, according to what doctor has said, and what I normally say, and what I normally tell people. You know, for us Kenyans, we say, I cannot be screened. Let me die of what I don't know. My friend, you better die of what you know. Because when you know, you can seek medication and have 50-50 life. You can survive, you can die. So you see, you have a dice of two sides. If you don't want to know what is happening in your body, you are waiting to die. So you better come out, get screened, know your stage. The earlier the better. You take shorter time. You get lesser pain, and also the cost is lowered. And you go back to activities as a normal person. If you take long, as Daktari has said, it's more painful. You incur a lot of money. You take a lot of time. And by the time you're finishing the treatment, you might never be the same again. Yeah.
So Irene just mentioned about the problem starts with the diagnosis stage. As a doctor in this industry, as a specialist doctor in this industry, have you met patients who are misdiagnosed with this particular cancer, and they started maybe the treatment, and then maybe now you're like, no, you don't even have the cervical cancer? And how did you go around about such a situation?
Thank you. First, I think I like to applaud Irene. I'm super impressed by her courage and her mentality. And I think she was the right person for this show, because the message she's trying to put out across there really resonate with the masses. So the issue to go back to your question is, of course, you have met. It's not a common occurrence, but rarely, 1 or 2 cases, we have met where people have been told they have cancer, and after repeat of the tissue, it is, and there's no cancer, or after surgery, there's no cancer. It happens, but rarely. It's not a common occurrence. And of course, there's nothing which is 100%. Most of the tests you have, they say is 99%. There's a disclaimer there. It happens, and also, but the challenge is when people go to the wrong specialist for treatment, and of course there's a confusion. Doctor, the term doctor is very ambiguous in general, but doctors have different area of specialty. The same thing like oncologists. Oncologists, we have so many types of oncologists, and they have their specific or scope area of practice. And we always we can't blame the masses, because when you go, you don't know, you're told is an oncologist or is a doctor, unless the doctor himself or herself is honest enough to tell you, this is not within my scope, the right person to handle this type of ailment is this specialist. So it happens, but rarely it happens.
All right, and now let us perhaps talk about the side effects of being diagnosed with cervical cancer. And I'm just going to give an example. For example, I'm a young girl. I don't have a child yet. I'm diagnosed with cervical cancer. Does that affect my fertility? Will I ever give birth if I'm diagnosed with cervical cancer? Or does it depend on the stage that I was diagnosed with?
Thank you for that good question. It cuts across. One, it depends with the stage. Of course, if you're stage 4B, we can't be talking about saving your uterus and ovary. We'll be more concerned of saving your heart, because the heart is the most critical organ. You better have a functioning heart than not having a functioning uterus. So stage is key. 2, there are measures we put in place for young women who haven't achieved what we call their desired family size. In layman's language, the women who haven't given birth or haven't completed giving birth. So if it's early stage, there's the criteria we use, and we can try to remove only the cervix. Remember, cervical cancer affects only the cervix, which is the bottom part of the uterus. And the uterus is the one which carries the baby, the womb. So sometimes you put measures, we can do some surgeries, which you call fertility sparing surgery, to try and remove only the cervix and leave the patient or the client with the womb and the ovaries. When it comes to advanced, like where you don't have to put surgery, you have to give radiotherapy and chemo, she'll tell you the radio hits all the pelvic area, the lower abdomen, and sometimes ovaries are found there. Ovaries are key, and for you to conceive and for the womb to have a fetus or a baby to carry. So sometimes you try to transposition the ovaries from the radiation field, so that when the womb and the cervix is hit, at least the ovaries can be spared. But now the challenge is, or the caveat is, that when you do that, you can only conceive through surrogacy. That what you harvest your eggs from the ovaries, then you get somebody else, another woman, to carry the baby for you. Yeah.
So apart from the fertility, what are the other side effects of being diagnosed with cervical cancer?
First of course, I mean, cervical cancer affects the birth canal. Of course, there'll be bleeding, there'll be discharge, foul-smelling discharge, there'll be pain, but the more pronounced side effects comes with the treatment of cervical cancer. And I said for surgery, of course, we'll have to remove your uterus and sometimes ovary, depending on your age. Which means you can't conceive babies. Sometimes the surgery itself has its own complication. I mean, there's no surgery which is 100% safe. You can have complication arising from the surgery you go, and also you have a complication from the radiotherapy and chemotherapy. The therapy is quite, has its own pronounced side effects. I don't want to say the word strong, but has its own pronounced side effects. Like you can have, for chemo, you can have hair loss, you can have suppressed immunity, you can have vomiting and diarrhea, you can have what we call peripheral neuropathy, numbness of the extremities. For radiotherapy, you can have what we call chronic proctitis, that is inflammation of the rectum, inflammation of the bladder, chronic cystitis, narrowing of the private part, what we call vaginal stenosis. You can have also enteritis, that's inflammation of the colon. Of course, I touched about the hair loss for chemotherapy. Yeah.
Irene, perhaps if you can talk to us about some of the side effects that maybe you incurred during that time, if you can share some of them.
During my treatment, yes. What I can say is that God favored so much. I never lost my appetite. I never got diarrhea. I never vomited. So you see how mine was. I was very much okay. And even the treatment was working very well with me. Why? I don't know. Why? I don't know. Because there are some people who go through so much. They are diarrheaing, they are puking. But of course, I lost my hair. I lost my color. I lost weight. That was during my treatment. After the treatment now, I just experience nerve problems. My bones are said to be weak, so I normally take calcium tablets and also eat food with a lot of calcium. Yeah, my memory had gone, but now it's coming back. Because there's a time I could not have spoken English. Today I think I'm doing it. Isn't it?
You're doing amazing.
Yeah, so my memory is coming back.
So maybe to touch on what she's saying so that it's clear to the audience is that, people react differently from their treatment. There are some people don't experience some side effects, there are some people experience others, so it varies. But what is key, and we need to underscore, is that the side effects, the treatment outweighs the side effects, the benefits of treatment outweighs the side effects. So it's better to be treated and have those side effects and get cured than avoiding to go to be treated because of the side effects and at the expense of not being treated. And also it's good to emphasize that there are measures in place we put to try and mitigate or reduce the side effects. Chances like you give medicine to prevent vomiting, diarrhea, some people even there are some for hair loss, and even the machines nowadays, there's a new machine for the therapy, Linac, which has less pronounced side effects than the previous machines. I mean, medicine is advancing every day, and people are trying to come up with measures to reduce the side effects, because sometimes they can be quite serious. Yeah, but people should not fear to seeking treatment, because the benefits of the treatment outweighs the side effects.
All right. Now, let us now talk about the cost of treating cervical cancer. Most people say, oh my God, you have to do fundraising if you don't have the NHIF, as Dr. said earlier. First of all, let us start with you. If you had NHIF, for example, how many sessions did this NHIF cover for you? And if you did not have, in a scenario that you did not have this NHIF, how would your life have been today when it comes to matters treatment and the cost of the cervical cancer?
Okay, just like anybody else, I didn't have an HIF because you see, hatutakangi kutoa pesa, and we believe sisi hatutagonjeka. You see, this is the mentality we have. So wakati niligonjeka, I didn't have the NHIF, nililipa na ilinisaidia sana. it catered for my chemos. Na ile kitu tu haikusimamia ni blood work. Blood work tu ndio haikusimamia. Unlike nowadays, you find somebody has paid NHIF up to 2025, lakini hana kitu kwa account, hawezi tibiwa. Anatoa cash kwa mfuko. Maybe daktari might tell us whether this is so.
So, if you allow me to, indulge myself in that question, is one, I think it should be clear to all Kenyans that you need an HIF. And of course, the SHIF, now the actually is called SHIF, I think we should do with that term, and maybe take time before we do away with that term of SHIF. SHIF should be mandatory. I think the new act, which was, I think, upheld by the courts, I think, last week, one of the key things was that mandatory should be mandatory. And you find Kenyans, sometimes I find Kenyans I'm one of them, we are very gullible. You find a Kenyan is having a voter's card, but it doesn't have, or she doesn't have an HIF. Of course, the voter's card is equally important, but I think the health card, your health comes first. First before anything else. Because, and when you have the SHIF card, things become much easier. Investigation becomes much easier, treatment becomes much easier or cheaper, because if you don't have an HIF, you pay 100% out of pocket. If you have it, like in our facility, it covers almost 80% of the cost. You have heard from her, maybe where she went, not in our facility, it was, at least the blood work wasn't covered for. But I can tell you, if you come to Kenyatta University Teaching Hospital, most of the treatment will be covered 80% by the SHIF.
All right.
Yeah.
All right, and if my director can give me 2 minutes or so, just 1 minute each, a parting shot when it comes to this topic, cervical cancer, just a minute each, parting shot.
To end up.
Yes.
Lastly, what I would like to say, ninaweza ambia wa mama, ni mwezi wa cervical cancer awareness, and there is a lot of free screening. Kindly come out, get screened. Kama unanisikia ama unaniona, chukua hatua, kuwa mjasiri, enda upimwe ndio ujue hali yako ya cancer, especially the cervical cancer. And as we have said, it's curable. Na sio uchawi, sio kurogwa. It's not many things that we are going to the family line, ati dada yake alisema nini, babu yake alisema nini. This is a disease like any other disease. Yeah.
Perfect, Doctor.
Mine will be one, make sure you get a SHIF card. It will come in handy when you need it. 2, all women of age, that is 21 years and above, kindly go for screening of cervical cancer. Not only cervical cancer, even for breast, or any screenable malignancy. Let's go for screening. Cervical cancer is screenable, is preventable, is treatable.